Hello! Welcome to our Facebook Surgical Support Group Live Facebook chat. Please let us know you're here. I'll let you know. My name's Laura Grabo, and I'm one of the behaviorists here at Grand Health Partners. I've worked here 13 years now, and my passion is doing actually this, giving our surgical patients support on the journey.
Hi, my name is Christy DeLaura. I've also worked at Grand Health Partners for a number of years, I think 11.
Yeah.
And probably the highlight of working here for me has been doing surgical support groups for the last 10 years, I believe. So we're excited to share some information with you today. Please feel free to ask us questions, and we will try to respond. We're going to start today by just sharing some resources that are available to you. And then after that, we'll answer a few questions that got sent to us, and then we'd love to hear other questions from you. So,
Hi Beth, glad you're here.
yeah.
So one of the best things about Grand Health Partners is our behavioral resources that we have for you here. And Christy and I are going to share a couple with them. First of all, I would like to talk to you about surgical support group and groups that we have here. Maybe Christy, you could take that one over. What are some of the behavioral resources we have besides this online one, the groups?
Certainly for surgical patients, you have a lot of resources at your disposal. In your first year after surgery, I would highly recommend checking out surgical support groups that are specific to surgical patients. So we have every Monday night from 5 to 6 here at Grand Health Partners, and then every other Tuesday, 6:30 to 7:30, we have surgical support groups. And if you want to know the next Tuesday that we're having it, it's not this coming Tuesday, it would be the following. So it would be February 7th, I believe, is when we will be having the next surgical support group here on Tuesday night. In addition to that, you are welcome to attend our medical topic groups where you'll hear about topics such as emotional eating and goal setting. And in the next few weeks, we're going to be talking about dealing with shame and vulnerability. From the book Daring Greatly by Brene Brown. We invite you to come join us. It's great material. So those are available to you. Some of you live not close to Grand Rapids, which is why you're utilizing this format. And so we encourage you to see if there are some surgical support groups in your area. We have a link to some outlying support groups on the website, I believe. So please check that out. I know we have them mostly on the west and northern part of Michigan. So absolutely check those out and contact those group leaders to see when they're holding their next meetings.
I see there's a question that come in. I think it's from Tara. Tara, you have a question. Do we have a surgical support group in the day? We do not have an actual surgical support group in the day, but what we do have is those behavioral education groups, which many of our surgery patients do come to. I lead those. We offer them on Thursdays every other week. There's a 9 o'clock in the morning, and then there's also a noon, and that's where we're addressing topics like emotional eating, body image, dealing with shame, like Christy just mentioned, and we would love to have you attend those. Those are the ones we have right now during the day. And all of this information you can connect with on our website.
And we do encourage you, if you have opportunities to give feedback and there are enough people who want a support group during the day, mention it, and we try to really meet patients' needs. I know a few years ago we tried to hold a surgical support group during the day, and we didn't have enough of a following, but we're open to new ideas. Something else I wanted to share with you too is that we do have a mentoring program through Grand Health Partners. So I have a list of, I think I'm up to about 20 surgical mentors right now, men and women. Some of them are as far out as 10 years from surgery, and some of them just had surgery within the last, well, they're at least a year out from surgery. But they are willing to be contacted by phone or by email to encourage you and to support you. Feel free to let me know, or Laura. I think that information is also available on the website, our email addresses, and we'd be glad to connect you with a mentor. A lot of people find connecting with a mentor even before they have surgery to be very beneficial in answering the questions. The hope of the program is to connect you for accountability and not just a few questions answered, but an ongoing relationship.
And I think, like Christy said, we value patient feedback, and that's why we're here. And we are so passionate, because we're the behaviorists, to share with you So many resources, like our mentor program, like our groups. I want to mention a couple of resources that Christy didn't mention, and then we really want to open up to you. We're seeing people check in. That's great. Welcome. We're glad you're here. Some of the other behavioral health resources we have for you include books. Those of you who have already attended our groups, but we know a lot of you aren't local, is we recommend a lot of books working on thinking and then also working on our emotional relationship with food. So many of our surgical patients say to us, I had surgery here, I didn't have surgery here. And so 2 great books that we recommend, and and these will be, we can on the website as well, is we recommend the Diet Trap Solution, Train Your Brain to Lose Weight and Keep It Off for Good. And these are those thinking tools to go along with your bariatric surgery, the headwork tools that you need. We are also going to be kicking off a class. So many of our patients through the years buy the book and then they say, I don't do anything with it. So we have developed a class, and that will be kicking off actually in March. And that will be in the day. I know somebody asked for the day, time hours. It's going to be Friday. Starting Friday, March 3rd, it's going to be 11 o'clock in the morning every Friday for 8 weeks, and that information is on the website as well, and I would love to see you come. The other book we recommend is 50 Ways to Soothe Yourself Without Food. Dr. Susan Albers really gives a lot of great expertise on how to combat the emotional eating, how again to work with our patients who say, I know I'm not hungry here, but I'm hungry here. And so we recommend that book for you as well. And then if you're able to come to our groups, you'll see a lot of our behavioral education is talking about things like emotional eating. Now also, some of you might be thinking, but I need more than a book, I need more than a group, I'm really struggling. And we have seen that with our patients as well, and so we have a whole list of counselors that we refer to in the Grand Rapids area who really have some training and specialization working with bariatric surgery patients. We know you have unique behavioral health needs, and so if that's something you're interested in, I want to say good for you. It's a great way to self-care, and we have a list that's linked on our website as well of all these outside counselors that are more than willing and capable to see you and help you on your journey. Finally, the podcast.
Yes.
How many of you have heard of Rieger Cortell? If not, you're definitely going to want to Google her, and she is a bariatric nurse practitioner that really specializes in podcasts, and I slipped and called her a behaviorist because when I met her, I thought, you're a behaviorist, she gets it. And Christy, I think you just had a patient who said she listened to how many of Rieger's podcasts?
I believe there are 79 podcasts, and they have different titles about different aspects of bariatric surgery. And this patient listened to all 79 of them, so 79 hours of podcast while she was at work. And so if you're someone who commutes, or when you're working out, you need something good to listen to, you can pick what one specifically you want to listen to. This patient said they were all helpful to her. Some are very surgery specific too. She has some about the lat band, about the Roux-en-Y, about the sleeve. So I would really, really encourage you to check those out. Patients have checked them out before they had surgery and found it to be very informative as well.
And I see someone just asked how to spell her name. It's a unique one, so great question. It's Rieger, R-E-E-G-E-R, and then Cortell, C-O-R-T-E-L-L, and she's NP, nurse practitioner. So you should be able to find her that way. I'm wondering, do any of you have any questions that you would like to ask us? Has any other ones come in? Let's see. What was the name again? Her name is Rieger, R-E-E-G-E-R, Cortell, C-O-R-T-E-L-L.
And I believe the name is the Weight Loss Surgery Podcasts. So
Weight Loss Surgery Podcast. Any questions out there? It looks like we have 10 people tuning in right now. That is great. Do you have any questions for us? Well, you think about them, and thank you to those who've already written in some questions to get us ready for this. And one of the questions that came into our office was, how can you tell the difference between real hunger and emotional hunger? And we often hear that, how can you tell the difference between physical hunger and emotional hunger? That is a great question. What we've learned from our surgery patients over the year, especially right after surgery, it's a wonderful tool that's helping you not feel physically hungry anymore. But they'll say to us, but my head is still hungry. And so one way that Christy and I teach on how to tell the difference between that is exactly, let's look at, is it physical hunger or head hunger? And physical hunger, you're going to feel more physical symptoms of feeling empty, lightheadedness, dizziness. And again, just by having bariatric surgery, we know that that has changed your metabolic system, and your ghrelin isn't really telling you you're hungry that much anymore. And so if you're feeling physically hungry right after surgery, that's a good clue to say, this isn't physically hungry. I can't be physically hungry because I just had bariatric surgery. So what is emotional hunger? It's back to that head. It's tied to our senses. You could have just filled up, you just had bariatric surgery, you're getting your protein in, and you hear something in your head that says, you know what, I have a taste for something sweet right now. Or popcorn sounds really good. Or, gosh, I saw the bread and that looks really good. Did you see what I did there? It's the senses. That's how we know it's emotional hunger. It's that sounds good. I have a taste for something sweet. That looks really good. Or, oh, I smelled some movie popcorn. That smells good. That's how we tell the difference between physical and emotional hunger. Physical symptoms versus more emotional. But here's another big one. How do you feel after you actually eat? As a bariatric surgery patient, when you are eating and filling yourself with protein, you will feel physically full. Okay? This is how you know it's emotional hunger. Well, first I ate some protein, and that didn't do it for me. So then I think I had a taste for something sweet, and that didn't do it for me. And then I had a taste for something salty, and that didn't do it for me. So then I thought I had to combine them, and it still didn't do it for me. How many of you can relate to that? Guess what? None of it's going to do it for you because you're not physically hungry. You're emotionally hungry. With the tool you have when you do experience physical hunger and you put food in, protein, you will feel satisfied. When you're emotionally hungry and you put food in, you're not going to feel satisfied. So that is a big difference on how you tell the difference between physical and emotional hunger.
I have a patient who's further out from surgery, so she does feel hungry sometimes, but she also struggles with emotional hunger, and she has gone by time. So she sets her phone, and she cannot eat until it dings at 2.5 hours because she knows that she can't tell the difference between physical and emotional hunger very well. So she goes more by increments of time, and she just says, I'm choosing not to eat until it dings, and that's my signal. So sometimes you have to do the timing even.
Right. I see a question there. When does physical hunger come back? Again, Christy and I are the behaviorists, so we're going to give you the behaviorist answer. I think it'd probably be best our doctors and our surgeons giving that answer. But what we can share with you is what we've heard from our patients' stories. And usually when we hear that physical hunger is coming back, it's probably a year to 18 months.
Mm-hmm. I hear it sooner sometimes, 9 months sometimes.
9 months.
But I think they're still in the stage of pulling apart what's emotional and what's physical.
So I hope that information was helpful on the difference between physical and emotional hunger. I think, Christy, we had another question come in.
Mm-hmm. We had a question come in earlier in the week talking about coping methods for dealing with anxiety around food and eating in the real world. A lot of patients struggle with food initially after surgery because you're doing it really differently, and people are watching you, and so there is some anxiety when it comes to eating in front of other people. So know that part of that is normal. There are some things you can do to help with that anxiety. The first one I would encourage you to do is find non-food ways to spend time with others. So if your routine was always to go out for dinner with a certain friend, initiating a walk or doing something different instead of it centering on food if you're really uncomfortable. Other things you can do is look online ahead of time at the restaurant you're going to. Make a decision about what you're going to have. Looking at the calories, that makes you feel a little less anxious when it comes to going out. But then using some of Judy Beck's techniques of when you're eating, make sure you're always sitting down, that you are chewing really well, that you're putting your fork down between bites. We have a lot of patients talk about how when they go out for dinner and they're with friends, they forget those things. They eat too quickly and they get ill. So putting that fork down in between, making time to socialize can be very, very helpful. Certainly, just planning ahead can make a big difference in that. But know that some of that anxiety will pass as you get further out from surgery and get more comfortable with eating and what you can and can't have, what agrees with you, and learning, how to deal with people watching you really closely after you've had surgery. Use it as an incentive to make really, really good decisions and to show them what a great lifestyle change you're making. But some anxiety can be normal. Laura, do you have more on that?
I think you covered it. I see a couple questions coming in. It's hard to eat and sit for me now, very common. Are there mental plateaus that people hit in the weight loss journey? I've lost 103 pounds now and my loss has slowed dramatically. I wonder if in an unconscious feeling like I've hit my goal. I think there's a little bit more coming in. You keep asking that question and we'll come back to it, because a question that I saw before that was, are there tips to make emotional hunger go away? And the first thing is, we can't make it go away. That's my answer to you. You have to learn how to cope through it. And the first thing you need to do is exactly that first question, is identify, is it physical hunger or emotional hunger? And if it's emotional hunger, we don't want you to eat, okay? We want you to say, okay, what am I really hungering after? And what we've learned with our patients is it could be the anxiety that Christy just talked about. It could be that they're bored. It could be that they're sad. It could be that they're trying to avoid conflict. And these are all the things you'll learn more about when you come to our groups. But there is a tip. And I know many of you can't make our groups, and so Christy and I recommend that you create what we call an emotional eating emergency box, and that you create this before you feel that strong urge to eat, because when the craving hits, it is powerful, and we don't want you to try to have to go and look and say, how do I distract myself? And so, let me just grab it. We keep it in our office. Christy and I recommend that you create a box like this that when you say, okay, I'm not physically hungry, I'm definitely emotionally hungry, I need to distract myself, what can I do? And some of the things, I won't go through everything in this box, is bubble wrap. Do you know how much bubble wrap you can get at the dollar store right now? So a big roll. These are for the people who say, I feel like I need to do something with my hands when I'm watching TV or I'm frustrated, so some bubble wrap. Adult coloring books. Christy and I teach a lot on mindfulness skills. That is really the intervention to help us with our emotional eating. A lot of people are talking about adult coloring books and getting distracted using that. Some people always say they need to get busy with their hands, so they like to knit and do something like knitting or
scrapbooking,
woodworking, that sort of thing. Another thing, this is really old school, I usually have my phone in my emotional eating emergency box because there's so many games we can play on our phone, but this is just an old school Sudoku, got at the dollar store. We want you to distract yourself, because guess what? When you distract yourself, it's not how do I get rid of emotional hunger, it's how do I cope through it. And when you distract yourself, guess what? It will go away. Guess what? Physical hunger, it doesn't go away. That's another way you tell the difference. So I recommend all of you create an emotional eating emergency box that you have it right there and ready to go. Any other questions?
To address the mental plateaus question, it has come up in group before where we've had patients say, I am finally at the weight I was at when I got married. And now I feel like it's good enough and I'm just going to stay here and I'm stuck. I do believe there are some certain weights that signify or that bring up some powerful emotions, whether it be breaking through the 200 barrier or being at that weight that you once were, that maybe life was really good at. So I think there can be mental plateaus. I would encourage you, if you feel like you're hitting one, to get some good support and accountability around you, as well as setting a goal so you can work your way through it.
Right. I think with the mental plateaus, I'm just going to push because it says see more, because I think there's more to your question. Okay, you would like to lose more weight, and you're wondering if unconsciously you feel like you've hit your goal. Again, I think that, how Christy brought up, there's some powerful emotional issues that can come up with our number on the scale. And this is where we're really going to recommend, I love that you're already having that awareness. Is there something that's not conscious about me that's affecting my outcome? And there is something called self-sabotage. that we have learned from our patients, and there's a lot of psychological reasons why we self-sabotage, but those are best taken care of in a one-on-one counseling session. So I think it's great that you're asking the question, and it's great that you already have this insight, but I would love for you to connect one-on-one with a counselor, and you can email us. If you're not in the Grand Rapids area, we could try to get you connected with resources where you could jump in and say, okay, is there something subconscious, behaviorally going on that I'm sabotaging myself to not keep going?
Or is it with goal setting that you need a new goal? And
Right.
we talk about getting stuck in parks sometimes where we say, okay, I'm a lot better than I was. And so we get comfortable rather than thinking about where we actually want to end up. 'Cause
Absolutely.
it's better, but it's not the best. And so
Right.
sometimes setting a new goal can be very helpful with that as well.
Anything else? Otherwise, we'll go to some questions that came in.
Thank you for your kind feedback.
Yeah. And I'm glad someone says it's nice to have wonderful support through the journey. That's actually what our topic group was just about this week, that all of you could have attended. We offer 6 behavioral education topics. It was on building your support team and how important it is that you don't go through this journey alone. Because I have to ask you, would you try to manage any other chronic medical condition alone? Obesity is no different. You need to continue to have support, and Grand Health Partners plays a role in that, but we hope you have people in your lives outside of that as well. Okay, another question that came through is, how do I deal with controlling and judgmental people? Well, this we thought of what we hear from our patients, food police. How many of you have food police in your life? I'm sure you've had them both pre-bariatric surgery and post-bariatric surgery. And should you be eating that? Or judgments about what's on your plate, or food pushers. Maybe you have food pushers that feel controlling, that say, you know what, I made this just for you. Why aren't you eating it anymore? Can anyone relate to the food pusher and food police? Comment below if you can. What we've thought is, what I've learned is there's 2 tips that Christy and I have taught to our patients in our groups. And one is called the entitlement exercise, we call it, and the other is an empathy sandwich. And the first one is, I want you to think of Aunt Susie, who is pushing food on you, okay, or policing. Is that on your program? And I want you to ask yourself, how upset is Aunt Susie going to be on a scale of 1 to 10 if I don't take her food? Okay? How upset is Aunt Susie going to be on a scale of 1 to 10 if I don't listen to her police advice that she's giving me? What we've learned from our patients is that Aunt Susie is probably only going to be maybe a 5 or a 6. Some of you might be thinking, you don't know my Aunt Susie. She's going to be really mad. I said, okay, Aunt Susie's going to be at an 8. But then here's the question. How long is Aunt Susie going to be at an 8? Probably until the person next to you takes the piece of her apple pie. She's going to forget about it. So here's the entitlement, though, for you. How upset are you going to be if you allow the words you've given me, a controlling and judgmental person, to trigger you to go off your program? How upset are you going to be on a scale of 1 to 10? What we've learned from our patients is that you're going to be a 10. And sometimes they say a 10 plus. And how long are you going to stay at that? What we've learned from our patients, when they go off plan, they stay at a 10 plus, sometimes as long as a week, because that just starts this snowball of stinking thinking upon stinking thinking, and I've already blown it, so I might as well blow it big. So I gotta ask you, why is it okay not to offend Aunt Susie, who's maybe gonna get to a 5, but doesn't stay there that long? But it is okay to hurt yourself, who is going to upset you at a 10 upset and can bring a lot of destructive behaviors. So Christy and I work on creating a healthy sense of entitlement, that with these controlling and judgmental people, you are entitled to your wellness journey. You are entitled to stick to your plan and say no, no thank you, no, no thank you. Now, a quick one on the food police, okay? We all have food police in our lives, and I really believe they're trying to be helpful. So you need to give them the benefit of the doubt, and this is what I call my empathy sandwich. I want you to start with something positive. I want you to say thank you. So they said, are you sure that's supposed to be on your plate? Is that on your program? Are you supposed to be eating that? I think you need to say, You know what? Thank you. I am so glad that you have an interest in my wellness journey and want to support me. But what I'm learning is when you police what's on my plate, it's not helpful. But here's what you can do. And that's the most important. Here's the sandwich, right? Did you hear it? I thanked them for wanting to help me. And then I told them clearly, it's not helpful when you play the food police. But here's what you can do. And that's what you need to figure out. You need to tell your support group, could you be my friend on MyFitnessPal? Could you send me a text once a week and ask me how I'm doing? Could I check into you after I have an appointment at Grand Health Partners? So again, communication, letting them know, thank you for wanting to support me. This isn't this isn't helpful, but this is what you can do. I don't know if you want to add to any of that.
No, I think it's great. I think it's great. I saw a question come up where a patient said her family members were worried that she was getting too skinny, and they had a lot of opinions about that. What I hear from patients in support group, because that's a normal comment, you look really different to them. You are changed, and sometimes that change is hard for family members to adjust to. Sometimes there's jealousy there, where maybe you're at a lower weight than they are, and that changes some dynamics. But I have patients often just say, I'm working with my doctor to find the right range for me to be in. So I'll talk with my doctor about what weight I should be at to be healthy. Focusing on the health part, not so much the pounds, but the health. What would you add to that?
I would add to that. First, I just want to validate what a struggle it is for so many of our patients. They get all these comments about their weight before surgery, and then they're finally getting healthier, and then they get comments from their family that they're too skinny. And that can be so frustrating. You feel like you can never win. And I have to agree with Christy, is focus on the health and focus that you're a patient at Grand Health Partners, that you are under medical supervision for lifetime. That's what I love about this place, is we don't do surgery and say, see you later. We want you to continue to come back. And I can assure you, if we have patients who are getting too thin, we talk to them about it and we get them connected with resources so you can assure your family members, again, thank you for being concerned, but my health is being monitored by Grand Health Partners, and I have complete trust in them. It would be more helpful if you could do this for me.
Thank you.
I think we just have a few minutes left. Do you have any more questions or comments? I know this is a new resource that we're going live. Anything you'd like to see? Nothing? Thank you. You're welcome.
Okay, you absolutely can watch this again. There are links to a lot of these resources we talked about today. Please don't hesitate to use them. With the support and the encouragement of others on this journey, it can help you through a lot of tough times, as well as help you to achieve your goals. We do have let's see. Sorry, I need new glasses. Okay.
Any tips on how to see ourselves as our new weight instead of the old starting weight? First of all, I want to normalize completely normal. Patients have said to us, I still see myself so much bigger than I really am. And so we see body image distortion pre-surgery. You don't see yourself as big as you really are. And then we see body image distortion post-surgery. You don't see yourself as small as you really are. And it's a very common phenomenon. There's actually a name for it. It's called phantom fat. I want you to Google it. Phantom fat. And we see it a lot in our patients. So first I want to say it's normal. So I'm glad you're asking the question. The next thing you said, what can I do about it? Check out our topic groups. We do a topic on body image, and this is where we address this. I would love for you to be at that group. We address it more specifically. And again, if you're not in the area, that's where I would love for you to get some counseling to work on the body image issues.
Some other things you can do with body image distortion or phantom fat is definitely utilize pictures. Pictures don't lie, the mirror can. So looking at pictures of what you actually look like, looking at the sizes of your clothes, there's a new one. Checking that size, reassuring yourself, no, I do wear a different size. Listen to the compliments of others in your life. Write them down. After a while, people get used to you being thin and you don't get those compliments the same way. So write those compliments down. And again, if you're still struggling with that, I think statistics say it takes about a year or two for your brain to catch up with your body. But what you wouldn't want to do is not see yourself accurately and give up your efforts because it's not working. And so if you're at a place where you feel like you just can't see the results and it's affecting your journey and your health, then absolutely seek counseling help.
Mm-hmm. Well, I think we are at a half hour and we're wrapping it up. Thank you so much. Thanks for all the positive feedback coming through the comments. Where's the Phantom Fat group? There's not a Phantom Fat group. We do a group called Body Image where we address Phantom Fat. But if you wanted to learn about Phantom Fat, if you Google it, there is some articles written about it.
We could probably link one.
We could probably link one onto the website.
We'll try to do that today then.
All right. Thanks for stopping by. Have a great day.
Bye-bye.